In 2010, 2.6 million persons with end-stage kidney disease received transplantation or dialysis worldwide. According to the World Health Organization, this number is projected to increase by 5.6 in 2030. Good evening. Welcome to Sound Health on Lagos Television. I am LASUCOM Dr. Our focus today is on chronic kidney diseases, and we are trying to look at what is this disease, how to prevent it, and the symptoms. Stay tuned. The conversation begins after this break.
Open wide, please. Hello, I'm Toothy, and I'm a dentist. Do you know what I see when I look in your mouth? I'll give you a hint. It's not just your teeth. Say, ah. Look at all the things a happy mouth can do. Taking care of your mouth makes you feel good and keeps your body healthy. That's right. A happy mouth really is a whole body experience. It can help protect your heart, your lungs, and your brain, and reduces the risk of unwelcome health conditions like diabetes and some cancers. Say, ah. See? Eating a well-balanced diet, low in sugar, avoiding tobacco and alcohol, and brushing twice a day with fluoride toothpaste helps you stay strong. And don't forget, regular checkups with a dentist are important too. Take it from me, Toothy. A happy mouth is a happy body. For more tips to keep you smiling, follow me. And bring your toothbrush.
It is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Amisu Mumuni, Consultant Nephrologist and Academic with Lagos State University Teaching Hospital and Lagos State College of Medicine. Good evening, Dr. Amisu, and thanks for joining us.
Good evening, and I'm happy to be here.
All right, thank you so much for finding time to join us on the show today. Okay, the World Health Organization says the number of persons with end-stage kidney disease will increase by 2030. Tell us, before we look at the projections now, what is chronic kidney disease?
Well, chronic kidney disease is a condition where we have a progressive deterioration in kidney function, which we know can be said to exceed beyond 3 months, and there are a lot of factors that will be responsible for progressive deterioration in kidney function, which can be accessed by the kidney function itself, by biochemical parameters, by radiological parameters, okay, by protein in urine, which can be consistently be over 3 months, blood in the urine microscopically that can be on for 3 months. In fact, lately we've added those who also had kidney transplants, also that will still be treated as patient with chronic kidney disease. It's a condition that is really fatal if not managed, and globally the exponential rise in death rates that you already read out is becoming alarming. As such, it needs both government and private intervention to curb.
Okay, sir. So many will ask, how do we get to that stage you just, the picture you just painted now? Does chronic kidney disease just happen overnight?
Well, like I said earlier, chronic kidney disease doesn't just happen overnight. It's a continuous deterioration in kidney function. And some of the signs are usually there. And the risk factors, which we know can be running for months, years. And if these risk factors are not treated, the kidneys get deteriorating in function gradually. And the signs are many that can give you point out the fact that these kidneys are really going down. And if it goes on beyond 3 months or years, the kidney can eventually be damaged, and the function can be as well. Instead of saying assuming 100% of kidney function, you now have a patient having function less than 60. And if we have that continuously for more than 3 months with some other factors, we may just adduce that the patient is suffering from chronic kidney disease. So, as we know, from all these factors, hypertension, the non-communicable diseases, hypertension, the diabetes, the infective causes, commonly the HIV itself, some toxic drugs, have been implicated in the etiology, the cause of chronic kidney disease. And we also have some genetic conditions, both in adults and children. Cysts, water collecting sacs, actually grow within the kidneys, and we call it genetic cystic kidney disease. And we can also have some associated with antibody, autoimmune disease, antibody of the same patient, same kidney. This is our kidney as enemy, and the antibodies attacking same kidney. It's not that common environment, but it's notable. And some instances, even sickle cell patients are not exemption to the cause of chronic kidney disease. And drug toxicity, as the case may be, like I said, infections like HIV. But commonly, let me emphasize this: the commonest reason why we have chronic kidney disease in our environment, Lagos, Nigeria, Africa, is both hypertension and diabetes. So yes, large number are responsible for the exponential rise in deaths and morbidity, usually due to hypertension and diabetes. So that should be noted. I'm talking about the signs that if you observe this going for months, if a patient notices that has been having, well, like I said earlier, poor blood pressure control, it's been hypertensive, and BP is not controlled chronically for over a long time, is one of the notable causes and most common causes of damage to the kidney. We also have an aberrant part of that we call chronic glomerulonephritis. Chronic glomerulonephritis. I don't know if the long broken jaw was of that, but it just means that if we have hypertension going in children and young adults, and at the same time cause kidney disease, chronic kidney damage, we call it chronic glomerulonephritis. So surprisingly, you can find some children at the age of 5, 6, 8, 10 being extremely hypertensive, and they have kidney damage, and it can go on to early adulthood, and we call those conditions chronic glomerulonephritis. It's very common because it's next common to hypertension, followed by diabetes mellitus. So these are prominent known risk factors that account for the such we say in the scourge of chronic kidney disease. And so signs are there. Some people are not hypertensive, they are not diabetic, they don't have chronic glomerulonephritis, they are not infected with HIV. But there are other signs they notice that they also make them come forward to be screened. If a patient or individual has been passing foamy urine, if urine foams, the telltale sign that there's a problem with the kidney. Although there are other factors, dementia, you can rule out. But if one has been passing protein in urine, it shows sign of foamy urine for more than 3 months, we need to investigate and ensure that this patient has not suffered chronic kidney disease. Likewise, patient passing out bloody urine. Sometimes microscopically it cannot be seen. But if you see this continuously for 3 months, we can also take in the patient for investigations. And some other things, waking up early morning with continuous facial swelling, leg swelling. This can progress to abdominal swelling, easy fatigability, tiredness. Okay, get tired and appetite, lots of appetite, you're anorexic, you feel nauseous, you don't eat, you get tired easily, and it's been going on for 3 months. These are also early telltale signs that need to be reviewed. And if such individual also found to be hypertensive or diabetic, we as well said that this patient can be suggested that be a subjective case of chronic kidney disease, which may need to be taken and investigated properly.
All right, Dr. Amisu. All right, is nutrition lifestyle related or associated with chronic kidney diseases?
Well, talking about lifestyles, which includes diets like salty diets, red meats, alcohol, excessive alcohol, smoking, they are not a direct cause of chronic kidney disease. They can always make it, they can worsen it in a way. And we also always advise that anybody, most of our patients should cut down their salt intake that can worsen, especially patients, individuals hypertensive. means of blood with intake. Red meat can also potentiate heavy cholesterol, which can inadvertently come with other risk factors or worsen kidney function, but they are not direct cause. Likewise, alcohol and smoking. In excess of taking alcohol in excess and smoking can lead to thickening of blood vessels and a narrowing of blood flow to the kidney and vital organs. This can chronically continue and damage kidney. So they are not direct cause, but they can also add to the risk factor, worsen it. Like I said, we focus more on hypertension, focus more on chronic glomerulonephritis, focus more on diabetes, latent infection like HIV, and some other risk factors, like I said, not too problem. And we can investigate especially in the tertiary center.
All right. When is a patient advised to go for dialysis or transplantation? What is the best form of treatment for chronic kidney disease, Dr. Amisu, from your years of experience? Let's get from your expertise.
The patients are properly assessed and properly assessed and considered to qualify for dialysis by physician or nephrologist. We have two major modalities of treatment, essentially dialysis and kidney transplants. Out of the two, kidney transplants is better than dialysis. The outcome, the quality of life outcome, and survival are quite better than dialysis on long run. So we advise patients to go for kidney transplants, which is better for but somehow in an environment because of policies, financial challenges, most patients stay more on dialysis, and because the kidney transplant is actually cost is really out of pocket for those Nigerians. So transplant is better, but the challenge, one, cost, two, availability of donors. As you know, kidney transplant policy in Nigeria is go around living-related kidney donor. The individual will come forward and donate for the relation, and this actually limits the donor pool, availability of organ for patients with end-stage renal disease, end-stage kidney disease that needs kidney transplant. So kidney transplant is better, and the need for donor, the need for the costs, consumables, and drugs are the challenges. And as the case may be, at our association level, locally and nationally, we are pushing up a paper, a proposal, and to actually empower legislation that empowers the use of cadaveric or diseased donor organ, meaning that individuals or any patients admitted in ICU or critical care unit that have been assessed by a competent physician, nephrologist, surgeons, as the case may be. They are said to be brain dead, but invariably they still have very viable kidneys that they can be harvested and be used to support life of needy individuals in chronic kidney damage. So this is a position paper, the national body, and let me just inform you that this Lagos State take head-on position on this. We have a position paper sent to the Lagos State Assembly. I understand is that we will pass the second stage, and if this become law, you may have to have the press media, the communities being educated on this and be familiar with the law. And this way, at the end of the day, have a lot of donor pool to save life. And this is actually the practice. This is the practice in the Western world. The disease donor organ transplants actually obtain the living-related donor transplant, and it's really a lot of life lost. When you wait too long on dialysis, the outcome to the survivor of patients after kidney transplant is not as good as those that usually have their kidney transplant done early, within short term on dialysis. Or even if you have it done without dialysis, which we call preemptive kidney transplant. They can be transplanted if the donor kidney is available, either living or But the pool will be more appreciated if we have law that backs the use of disease donor organ, and that will eventually save life.
All right.
So, yes.
Dr. Amisu, in 30 seconds, your calls to action as we wrap up now. For people living with the condition and those that are looking out for how to prevent chronic kidney disease.
Yes, let me just summarize that. Prevention is better than cure. We advise that individuals with family history of hypertension, diabetes should go for screening. We advise that BP, blood pressure control, diabetes control, and both are very key in preventing damage to the kidneys. Anybody with family history of chronic kidney disease should also come forward for screening. And we also advise that individuals that have family history, that has family history of hypertension or diabetes, should ensure they follow dietary restrictions, salt especially, stop smoking, stop alcohol or cut down extremely reduced intake. And we also advise that water should be taken at least early morning. And when the weather is very hot, the intake should be at least 3 liters per day. And this will also help address the kidneys and reduce the stress on the kidneys.
All right.
Thank you very much.
All right. Thank you so much, Dr. Amisu Mumuni, Consultant Nephrologist with Lagos State University Teaching Hospital and Lagos College of Medicine. Thank you so much for your time once again. We really appreciate you.
Thank you for having me.
Right. Sound Health continues with trending health report from around the world. Please stay tuned. The program is still Sound Health on Lagos Television. More to come in a moment.
Hey bartender, you assume that I cannot drink a margarita, so you don't serve me a margarita? So I don't drink a margarita. Your assumption becomes reality. And parents, you assume that I cannot live on my own, so you don't encourage me to live on my own, so I don't live on my own. Coach, you assume that I cannot hit harder, so you don't train me to hit harder, so I don't hit harder. And teacher, you assume that I cannot learn Shakespeare, so you don't teach me Shakespeare.
Old MacDonald had a farm.
So I don't learn Shakespeare. E-I-E-I-O. But hey, if all your assumptions become reality, then assume that I can drink a margarita. So you serve me a margarita, so I drink a margarita. Assume that I can live on my own, so I live on my own. Assume that I can hit harder, so I hit harder. assume that I can learn Shakespeare. So, what fools these mortals be! I learned fucking Shakespeare. You assume I can't swear, right? Assume that I can do that job, that I can go to parties, that I can have sex, that I can be on stage. Assume that I can. So maybe I will.
Thank you so much for staying with us this week on Sound Health. Hope you've learned one or two things about chronic kidney diseases. If you're at risk, if you have anybody with family history of chronic kidney disease, hypertension or diabetes, encourage the person to go for screening early enough. Prevention, they say, is better than cure. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 0035826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.